welcome to Aspen Ignites.
Thank you so much.
Advancing health equity is really at the core of so much of what you do. Tell me what it really takes to see health disparities improving in these historically overlooked communities that you do so much great work with.
People make it seem like it's so much more complicated than it is. It's really quite easy. It's two things. One, identifying the leaders who are already there solving problems, leaders who have proximate and lived expertise, amplifying them, investing them, and just ensuring that we celebrate and champion their leadership and invest in their solutions.
Indeed. Something that we've heard at this conference has been around how racial and ethnic concordance between patients and the healthcare providers who care for them really makes such a difference in their
Yes.
health outcomes. And I wonder if you can talk a little bit about what those improved health outcomes look like when we
Sure.
have that kind of representation in our healthcare,
Sure.
and how we widen the pipeline to get more doctors and providers from the communities that they serve.
Sure. I mean, it's just a human to human experience. There's nothing like seeing someone who looks like you,
Mm-hmm.
who knows the context in which you live, who can understand your whole self,
Mm-hmm.
that changes the way you engage within the health system. Oftentimes, the system is embedded with racist practices. And if you're not aware of the context within one walks in and the fear often that one walks in the health system, you will not achieve the sort of impact you want. People
Mm-hmm.
won't really adhere to the guidance you have because you haven't thought about them as a full person. So it matters a lot. As far as the pipeline,
Mm-hmm.
you know, we have to do a better job of starting early,
Mm-hmm.
of ensuring that young people see the opportunity for themselves. That's what, again, why it's important to see other people that look like them
Mm-hmm.
as leaders, as physicians, as community health workers,
Mm-hmm.
so they can see that there's a pipeline, there's a pathway
Mm-hmm.
for them to lead and grow.
Mm-hmm. Yeah. Speaking of leadership, women's leadership can be so transformative in the health equity space. And I wonder if you can talk a little bit about how you've seen women's leadership really transform health equity initiatives.
I see it everywhere.
Yeah.
I've been walking around campus all the last few days, and I've seen some of my heroes
Mm-hmm.
who are Black women who have not only just been leaders in their sector,
Mm-hmm.
um, transforming how systems work for me, for their communities, but have been the champions and the fighters and the brave leaders who have changed the way policies are designed,
Mm-hmm.
programs are implemented to include the lived experience, the power and passion of women.
Mm-hmm.
I also had the privilege of meeting an incredible actress and activist, Aria Mia Liberti, who's Zillennial, Gen X, I don't know, a young, powerful woman who just speaks to ensuring that we engage young girls early and sort of connects the dots between acting and activism and health. And, I just find myself so inspired
Mm-hmm.
by seeing women like her and other women leaders who have changed the game for me. And the last thing I just want to note around that is legacy. That when we invest and see women and girls leading in these spaces, it makes such a transformational, multi-generational legacy impact
Mm-hmm.
that inspires me every day.
You know, this session that you led, something that Aria was talking about in relation to women's leadership was about how so much of the way we view the world is really based on the writings and the thinkings of
Yes.
men. And a lot of the writings and thinkings of women are simply invisible to
Yes.
us. I wonder if you have any thoughts on what it is about women's worldview that makes them different leaders, especially in the health space.
That's such a good question. I always find myself saying women lead differently.
Hmm.
And at the heart of it, I think there's a natural sense of empathy,
Hmm.
of humility,
Hmm.
a recognition that we have to work together, that we don't have to compete with one another to succeed and to thrive.
Hmm.
I also think there's an innate embedded thinking around a next generation
Hmm.
that women sort of have built within them.
Hmm.
When I work with men and allies in this space, sometimes, especially when it comes to women and girls advocacy,
Hmm.
what I hear is, uh, I just had a child, I have a daughter now, and so I see the world differently. And while I love that, it's sad that it takes that kind of moment to see that the world is different for women and girls. And we have to sort of start to ensure that boys and our other allies are more connected to understanding the power and possibility for women and girls, and also can start to lead and live into that sense of empathy, humility, and the need to engage and partner and participate as a collective rather than competing and being our independent selves as we do.
There is so much in the ether right now about how to better educate boys and men in order to make the world better for everybody,
Yes.
including women. What are your thoughts on some of the most important things we need to do in that space?
Um, that's a good question. I think again, starting early
Mm,
and ensuring that boys and girls are sitting in the same spaces
mm,
and learning side by side how to listen to each other, how to
yeah.
look at each other, and how to value each other
Mm,
as equals, but also how to see the strengths and weaknesses in one another. I think doing that early is the most important part. I also think that modeling behavior
mm,
is key. So, we are also inspired and influenced by our leaders, be
mm,
they in media
mhm.
or policy leaders.
Yeah,
We need to ensure that we, as those influencers, as adults, are modeling the kind of behavior
indeed.
that needs to be replicated.
Preach. Yeah. So when boys see men having feelings, a full
Mhm.
spectrum of feelings, taking care of other people,
Yes.
I imagine they learn a lot from just seeing that
Mhm.
it's part of healthy manhood to take care
Yes.
of other people and to have feelings, and it's not exclusively the responsibility of women
Exactly.
to occupy that
We're
role.
doing enough.
Right. It couldn't be truer. Um, a lot of the work that you do is around localization
Yeah.
of our health equity initiatives and of healthcare. Talk to me a little bit about what that really means in this context.
It's such a big word. It's been thrown around, and at the end of the day, it's the fact that solutions are local. That we
Mm,
need to look at our community health workers. We need to
mhm,
look at our unusual suspect leaders. They could
mm,
be your local faith-based leader. They could be the grandmother that's sitting on the corner. We need to listen to those who understand what goes on in the neighborhood, what goes on in their community, and
mhm,
put them at the center of the solutions. That's localization.
mhm,
It's not complex, but it functions differently. And it means that we have to ensure that there's space for individualized solutions, that there's no one size fits all.
mhm.
But they're the leaders who understand what will work and what will be sustainable as far as a solution that's inclusive
Yeah,
and that's long standing
yeah.
in their community.
So I think a lot of the workers that you're speaking of that are the most impactful in this space are community health workers
Yes.
in both in rural and in urban places,
Yes.
both outside the U.S., inside the U.S.,
Mhm.
all over the world. What are the challenges to meaningfully and sustainably funding initiatives that have these types of
Yes.
community health workers at their core?
One of the biggest challenges is values. So,
Mm.
unfortunately, these are leaders who are highly undervalued. We know
Mm.
that, and they are overlooked
Mhm.
as far as seeing the power that they wield in a community. Moreover, they are underfinanced.
Mm.
So, there's lots of conversation about professionalizing this community health workforce.
Mm.
But in most places, they're not paid,
Mm.
they're not trained,
Mm.
and they are not engaged in the larger system. So when we talk about community health workers, they are working alone, carrying the burdens of health, which are not just direct service in their
Mm.
community. And then they're not included when decisions are made at the sort of direct service level within the primary healthcare system.
Mm.
So that disconnect is so sad. It really just makes more work for these incredibly important community leaders.
Yeah, you can't expect people to want to do this exclusively on a volunteer basis, right? You
Exactly.
need to have a means of making a living and
Yes.
perhaps means of advancement, career
Exactly.
mobility, and the same sorts of incentives that keep people doing other jobs for a
Exactly.
long time and doing it with a lot of heart.
Mm.
It seems like community health workers and other sort of localized health workers can do a lot, not just for providing healthcare, but for also disrupting health misinformation, which
Mm.
is one of really the biggest crises of our time. I wonder if you've seen any initiatives that have shown the potential for localized healthcare and also disrupting health misinformation that can be so damaging to people's well-being?
Oh, that's a great question, and it's where I want to lean in and step back and think about the trust that we have to rebuild.
Mm,
After the pandemic, when all systems failed, it was the community health workers that had that trust.
yeah.
There are a lot of examples globally. I have the privilege of co-leading a program called the Healthy Communities Fellowship, and through
Mm,
that fellowship, we have engaged leaders who are really building that pipeline
mm,
of workforce, the CHW workforce. We
mhm,
have a colleague who's doing work right now in North Carolina, and she started something called Community Health Resilience System. And
mm,
there they have trained, it's an open door. So anybody can walk into that door and engage with a CHW, a social worker,
mm,
who will speak to them like a human. And they come in with any need, and then they're connected. And
mm,
that's right there in their local neighborhood. So replicating these models of a center where anybody can, there's no wrong door.
mhm,
Anybody can walk in and say, I need help accessing food. My food stamps are disconnected. I'm about to lose access to my child.
mhm.
That's the kind of innovation. And I use the word innovation because oftentimes we think about innovation as some sort of tech, sexy, new model.
Yeah.
But the innovations that I'm inspired by are those just engaging more human-centered care is the action. That's the thing. That's the magic that is going to solve ourselves out of a lot of the crises that we're facing today.
One of the first things you said when we talked about how to fix health equity is that it's not that complicated.
Yes.
We have humans. We know that humans trust other humans
Yes.
who know them, who come from the same places they do, who understand the challenges that they live with because they live with some of the same challenges
Exactly.
themselves. And trust is not something that you can engineer, you can put on a
Yes.
chip, that you can grow in a lab.
Mhm.
It's something that exists organically.
Yes.
And I think you're right. It's really on us to tap into that in a more intentional, sustainable way. I'm so happy to hear
Exactly.
you say that. I want to ask you a little bit about where you're seeing localized healthcare play out in the intersection of vaccine equity and maternal health. Is this a space where there's been a lot of work, where there's a lot of potential that you see?
There's been a lot of work. I have the privilege of working with an organization called IMAC that has
Mm,
really been advancing policy globally around how to authentically achieve vaccine equity.
mm,
Part of it is about the financing modalities
mm,
for achieving vaccine equity. This means ensuring that there are true vehicles that enable decision makers, both at the national level and at the community level,
mm,
to determine what vaccines work for their communities when they need them, how to build sort of a bench that's
mm,
available to them.
mm,
I was reading recently, which was powerful. There was a new designed model for a new vehicle for uh, rolling out vaccines
mm,
globally, and the pushback was there was not enough community engagement in deciding what those policies should look like.
mm.
So globally, the platform is on pause because they recognize that we need to figure out how to, again, connect the dots between community input,
Yeah,
local input,
yeah.
and designing financing models, and also the power platforms
Mm.
to enable that vaccines are delivered not just equitably, but in a timely manner with the types of tools and vaccines that will be accepted
Hmm.
within community.
Who are the voices in these spaces that haven't been historically elevated and really should be?
Um, Activist organizers, but also local policy leaders.
Okay.
So typically what happens, decisions happen in Geneva. They'll convene in Geneva, Switzerland, make a huge global decision,
Hmm.
and amongst a handful of presidents and physicians, and that's the end of the story.
Hmm.
What doesn't happen is sort of taking an idea that
Hmm.
may be manifested in Geneva and then engaging, again, presidents, community activists, organizers, CHWs, and understanding, will this really work for us?
Mm. So really localization in
That's the
every
key.
sense of the word. Something else you mentioned as a potential really powerful actor in this space is faith leaders.
Yes.
And historically,
Hmm.
faith communities have done a lot of good for people's health, but especially thinking about more recent events have sometimes constituted a threat to women's health. And I wonder what you imagine as the role of a faith
Yeah.
community, faith leaders right now in moving women's health and equity forward.
We underestimate how people lean into faith for solutions, into
Mm.
faith-based leaders. I have one of our Healthy Communities fellows. Her name is Veron Blue.
Mm.
She works in Texas. She's a
Mm.
faith-based leader,
Mm-hmm.
and she actually has been spending a lot of time thinking about the role of the faith-based community and the mental health response.
Mm.
So she has actually been working very closely with faith-based leaders in San Antonio, convening them, letting them understand the science behind the mental health
Mm.
crisis and
Mm.
how they can engage more thoughtfully
Mm.
and being a safe space for all. And so she's one incredible example of how to engage faith-based leaders um, by extracting the judgment
Mm.
and opening a space for communities to come in feeling like they can actually trust. But again, it's about local engagement.
Yeah.
That works in San Antonio, but it may not work everywhere. But I think that if we do not tackle the power of faith-based leaders in all of our solution sets,
Yeah.
we're missing out on an opportunity.
I'm hearing you say that in many communities, they are really the trusted messengers.
Exactly.
But the trusted messenger of one community, and certainly of one faith community, is not going to be the trusted messenger of
Correct.
another. It's not as portable as we might like it to be.
Yes.
It's not as convenient. Really um, have to individualize these approaches.
Absolutely.
Yeah. It is sometimes a little challenging to feel hope
Ah,
and optimism
yes.
about women's health and about health equity generally. But you seem to have boundless hope
Yeah.
here. And I'm just wondering, where does that come from right now? What do you draw on to feel
Mm.
optimism about these initiatives and about women's health and equity more generally?
I have the best job. I am so privileged because my whole job is getting to look around the world and find leaders who are doing the work.
Mm.
And what happens is I don't have to do much work because I'm connected to enough leaders who are brilliant and they know other leaders who are brilliant and they have solutions. That's the hope. The thing that weighs on me or keeps me up at night is how do we continue to invest in these leaders, keep them safe? What I'm worried about right now for our leaders is they have the solutions, yes, but they are also carrying the burdens of their communities and they need a space to rest, to recover, and
Mm.
also the investment to delegate and share in the responsibility of leadership. So I am boundlessly hopeful. That is true. But I'm also a pragmatist. And so I am empowered, but because of their leadership, to find ways to ensure that they are truly authentically invested in.
Wonderful. Well, Lola, thank you so much for sharing in this
Pleasure.
conversation with me. Thank you.
Thank you.